So good evening to everybody, and thank you so much for joining me this evening. My name is Talia. You may be familiar with me. I've done quite a few of these webinars for Healthy Planet, sponsored by Healthy Planet and Now Health Canada. And tonight is on all things vitamin D, just such an important topic, I think very trending too, for good reason, because vitamin D is so important. Before I jump into my topic, I just wanted to do a few quick housekeeping notes for you tonight. So one is I will take questions at the end. I usually have a moderator here. I don't think she could make it this evening. There's some technical issues. She might have joined. Is that you, Lynn? If you are here, just pipe in with your volume so I know. And please turn off your camera, Lynn, because it's showing on my screen. All right, so you may or may not have a moderator here, Lynn Marie. I'm not sure if she was able to make it, but if you do.
Yeah, I'm here.
Oh, there she is. Okay. All right. Thanks, Lynn Marie. So Lynn Marie is here. She's going to be moderating your chat as participants. You can chat with one another, share information, whatever it is that you would like to do. But if you want to have me answer questions at the end, then please put that in the Q&A area, not in the chat, because I won't go through the chat. I'm just going to look at the Q&A. So the chat is to chat with one another or Lynn Marie, and she'll help you with some questions as she can. And if she's not able to help you, then like for more technical stuff, most likely I'm going to get to it at the end. Another thing is that this is being recorded, and the recording will be placed on the Healthy Planet website on their YouTube channel. Just go to YouTube and enter in Healthy Planet so you can watch it again and again if you want. If there's any slides that you really find interesting, you can always take a picture with your camera. We do not send out the presentation to the participants, so that's your access is watching it there. And I think that is all that I have to say about that. Lynn Marie will just jump in if there's any technical issues and stop me if my slides aren't advancing, if you can't hear me, but otherwise, here we go. So all things vitamin D. And just by way of a quick introduction for myself, my name is Talia Charney, as I mentioned. I'm the Nutrition and Health Education Manager for Now Foods Canada, an amazing company that I've had the privilege of training for 7 years. I'm a holistic nutrition and wellness coach. I'm also an author. I love writing, an educator, and a speaker. And I always like to put here my training values because I really do hold these dearly. Honesty, objectivity, nuance, and humility where I can manage that. And as I mentioned, I am with Now. So this is my extended family. Now is family owned for 56 years. It's a long time, longer than I've been alive by a little bit. And if you want to know about the family story, it is actually a fascinating read, and you can go to the nowfoods.ca website. If you enter just Beating the Odds, you can bring up this PDF book. Lynn Marie, I think your microphone may be on. If you can just mute yourself, I heard a little noise. And you can read that book in just a couple of hours. You'll learn about not only an amazing story, which it really is, but also the incredible quality of Now, who performs 19,000 quality tests on a monthly basis, but they've contributed so much to our health industry. It's a very long story. And of course, I do have to provide this disclaimer. This presentation is for general informational purposes only and does not constitute the practice of medicine of any type. The use of information written or stated here or materials linked from here is at the user's own risk. Information here is descriptive, so I'm describing what I have found. I'm a very savvy at research and I love to do it, but it's not prescriptive. I'm not giving you a prescription and telling you what to do. That is between you and your whatever healthcare professionals that you have in your life. whether it's medical doctors, maybe naturopaths, etc. But you can visit nowfood.ca for all suggested uses, doses, and cautions for products. So for questions like, does this interact with the medication, or can I take it if I have diabetes, that is always on the product. So that kind of information is quite easy to find. What's not so easy to find is all the other nuances about the topic that I'm going to bring up today. So let's start with, what is vitamin D? It's actually a very interesting vitamin because not only is it a vitamin, which is in the name, and a vitamin just means something that we cannot make at least enough of in our body to survive. So we must get it typically from food. But vitamin D is the one exception where we can, not only can we get it from food, but we get it from sunlight. It's amazing. I'll get to that. But also it's a steroid hormone. So it's a hormone. Got to have a little bit of healthy respect for that. Hormones are things that are produced in one area of the body, but then travel to all other types of areas and affect many other parts of the body. So we have receptors for vitamin D all over the place in the body, many areas, not just in our bones. Another important fact is it is fat soluble. So that means don't waste your money by drinking vitamin D between meals on an empty stomach, because it needs fat to be taken with it. Ideally about 2 teaspoons of fat or oil. Now you don't have to measure it in your meal. If you're eating kind of an average meal, you're going to have 2 teaspoons of fat. If you're on a very exceptionally low fat diet, that may be a problem. You will want to take your vitamin D then with 2 teaspoons of, could be any type of oil that you want. It doesn't matter. Olive oil, MCT oil, whatever oil that you like. And you probably know that it's involved in bone health. So it regulates bone mineralization. It enhances the absorption of calcium and phosphorus. In our bones, we have calcium phosphate as part of the mineralization that makes our bones nice and hard and tough. But they also have to be flexible. So tough but flexible. And then other things come into play there, such as collagen. And vitamin D as a hormone regulates hundreds of genes in our body. So that is why we suspect, and we have some evidence, that it does many things. It's very important. You can see down here, this is what vitamin D looks like. I like to do a little bit of sciencey stuff. It's fun. This is vitamin D if it's in the form of D2. And this is vitamin D3. So you'll find supplements D2, which is the vegan form. D3 is non-vegetarian, maybe a vegetarian form, but this one's vegan. They look almost identical, but this one, for those aficionados of chemistry, has a little double bond here. That one doesn't. And then when we measure it in the blood, if you go to your doctor and they measure it, it's a different form. You can see here the names are a bit different. So D2 is ergocalciferol, D3 is cholecalciferol. And then we have 125 dihydroxycholecalciferol. Now, don't worry about the messiness of this, but I just want to impress you, not about me, but about vitamin D and all the things it does. It is the multitasker of the century. It up and down regulates the down arrows and up arrows, many things in the body. So yes, it regulates calcium homeostasis, calcium, high or low, and bone mineralization, which is its most popular role, but it does many other things, such as apoptosis, which has to do with, cells and may have a role in things like cancer, nutrition, neuronutrition, endothelial protection. So the endothelium is the lining of all of our vessels. That will be important for cardiovascular disease. Antibacterial effects, antioxidant effects. It has roles in inflammation with many different markers in the body, and differentiation, which is when our cells go from kind of a neutral to some kind of a purpose. And that also has a role in cancer, but not only in cancer. So bottom line, it's a very busy hormone/vitamin. All right, so how is vitamin D made? I already gave that away and you probably know it a bit. But for one, of course, we can get it from our foods. I'll go through some of the sources. Dietary sources can include D2. That would be vegetarian foods like mushrooms, and D3. That's what you might get in fish. We can get it that way, but we also make it from the UV rays in the sun on our skin. And the interesting thing about that is it actually requires, and it's even in the word of the kind of precursor before we have vitamin D, cholesterol. So we actually require cholesterol. So let's never call cholesterol bad. It's all context dependent, but it does require cholesterol to make vitamin D. We can make it in our skin. Either way, from the sun or from our diet, where it goes in our digestive system, makes its way to the liver. In the liver, it is transformed to another form with the help of some enzymes. Enzymes are like the busy workers in the body. So we require a healthy liver, and then it is again transformed in the kidney. At that point, it becomes what we call that hormone form. It's activated, and then it has many receptors all over the body. And we know some of what it does, but we certainly don't know everything. So here goes. I have a little bit of a runny nose tonight, so excuse me time to time. Food sources of vitamin D. So let's have a look here. So the thing about food is generally it is of my opinion that it's very difficult to get, and from my experience with my clients, it's very difficult to get enough in your food for most people. So we do rely on sun, if not on supplements. So food doesn't tend to be a reliable way, unless you're having, maybe lots of cod liver oil, lots of certain kinds of fatty fish. Of course, some foods are fortified, but you can see the amounts here really vary a lot. That if you think in your average supplement people take is 1,000 IU, other than the cod liver here, there are not many foods that give you anywhere near that. And with mushrooms, it really varies. You got very low amounts here in some, and higher amounts in other. It actually depends on the mushrooms being out in the sun as well. In fact, I heard that if you take your mushrooms and you put them out into the sun, you can actually increase their vitamin D content, but I couldn't tell you by how much, but that's just an interesting little fact. And how much vitamin D we get from the sun will depend on where you live. So the higher you are from the equator, or the further away you are from the equator, either above or below, the harder it becomes to make vitamin D from the sun because it's just not as high in the sky. It's not as strong. But another factor, which is a little difficult to see down here, though, it has to do with your melanin in your skin. So here it says it takes 10 minutes if you have very light skin, probably someone like me, I'm quite pale. I might be able to make the same amount that somebody with a darker skin can for me in 10 minutes and for that person in 45 minutes. So those things both are a factor. And of course, we're here up in Canada, and there's certain parts of Canada that are much further north where there are times of the year where nobody's making any vitamin D, even if they're outside. Now, the shadow rule is something you should become familiar with, and it's quite fun, I think. So this is the rule. If your shadow, and look here, is longer than you are tall, you will not make vitamin D. Now, as soon as you can see here, the sun is at a 45-degree angle. So the shadow is longer. And as the sun goes down and down and down, your shadow becomes longer and longer and longer. When it's at about 45-degree angle, the UV index, as you might hear about in a given day, is 3. As it goes up to noon, it might go up to as high as 13 to 15. And that's when you're making a lot of vitamin D, but of course you can also get burnt, so we have to be careful. So one of the things that put us at risk for vitamin D deficiency? Well, there's many. Of course, anything that deprives you of sunlight, being indoors, wearing sunblock. I have to say, I have heard controversial information about this, because from some very official organizations say a sunblock reduces vitamin D. And I have heard on a couple of podcasts recently that you can make vitamin D when you have a sunblock. So I have to say right now, I'm not quite sure if you can or can't, something I have to investigate further. Let's just assume you cannot. Statin drugs. So if you're on statin drugs for cholesterol, well, these drugs lower your cholesterol. And recall I said you need cholesterol to make vitamin D from the sun. So in theory, you may not make as much vitamin D when you're on statin drugs, but you don't have to guess whether you are or you are not, because luckily we have blood tests, and I'm going to get into that. Winter months, we're always making less if you live at higher altitudes. Medical inpatients, of course, if that's because you're indoors, and the darker your skin is, the harder it is to make that vitamin D. So there's risk factors for D deficiency as well. Now, obesity is an interesting one, and it probably has to do with the fact that we store vitamin D in our fat and therefore becomes less accessible. Couldn't find a lot of really detailed, specific information in terms of like, well, how much to quantify the differences it make. But for those who are heavier or obese, they're going to typically be lower in their vitamin D. Older age, our skin is just not as efficient at converting that vitamin D from the sun. There's genetic variations. So given two people with, say, let's say, living in an identical place, same exposure to the sun, and same exact skin shade, whatever that is, even if they were identical, genetically speaking, the conversions of that vitamin D in the liver and the kidney may be different. And therefore, you can't assume that two people are getting the same amount. So again, blood tests are the answer. Fat malabsorption, so any condition like digestive condition like Crohn's, that sort of stuff. You have any fat malabsorption issues or suspect you do, that could affect it as well, because it's fat soluble as mentioned. Diseases of the liver or diseases of the kidney, because those are involved as well, may also affect. Magnesium deficiency, you've probably heard that it's sort of out there in the ethos that most people are deficient in magnesium. So magnesium is required as part of that conversion of vitamin D. And inflammatory bowel diseases, and I already mentioned the genetics. So just to show you here, because it's quite striking on this graph here, vitamin D in the aging population. So with every decade of life, your vitamin D production goes down, down, down. And this is with the sun, right? So it's quite drastic. So even if you've done a blood test and you've determined how much vitamin D you need, or your doctor has, or your naturopath, then you still need to recheck that and maybe adjust your doses as the decades go on, because you may be making less and less. Now, the big question, what is an adequate amount of vitamin D? Now, there is not agreement between everyone in this by any means. So you can see different organizations or countries here. We got Netherlands, New Zealand, the Endocrine Society, the Vitamin D Council, and they determine, like in the red here is where you're in the danger zone. A green is in the good zone. So you can see they don't agree exactly, but by and large, the most agreed upon cutoff point in your blood tests is 50 nanomoles per liter. And I just want you to remember that, just the 50, because I'm going to bring it up quite a few times. That's that cutoff point. So you don't want to be below that in your blood tests. And for the most part, that is determined, especially from someone like Health Canada, these sort of official organizations. I think that is mainly based on preventing osteoporosis or rickets if you're a young child. That is where they focus. That is where most of the evidence is, and is not so much based on needs otherwise or other uses of vitamin D, other roles in the body, because they're not as well established. But I'm going to show you tonight that there are potential other roles, and there's some evidence that suggests that you may get additional benefits from being in higher It doesn't mean high, any amount or any level is better going up, but there's certainly suggestions. And I myself, I keep my blood levels at about like 125 to 150 nanomoles per liter. Just so that you know that in the United States, they use different units, so the numbers vary, and that can be confusing if you're reading stuff. So I'm going to stick to, because we're in Canada, when I'm talking about an amount, it's going to be the Canadian amount. So 50 is that cutoff point. Life Labs, where I last got my blood test for vitamin D, their normal range was, they put 75 actually here as the bottom of normal. So even theirs is a bit higher, and 225 nanomoles at the top. So you don't want to go beyond that. I don't think it's very common to get anywhere near that, and I'm certainly not saying that you should. Are deficiencies an issue in Canada? Now, I couldn't find very current information, so I have the most current I could find. But this is really interesting to see. In 2003, 34% of 2 to 12-year-old children in Edmonton, Alberta, had insufficient vitamin Ds. Between October and March, in a place like Edmonton, Alberta, because again of the, above the equator, vitamin D production is 0. So we're not making any, some of us, during certain months. That also may mean that you might benefit from using more in the winter and less in the summer. But it depends, because sometimes people are indoors the whole summer anyway. So it might not vary, but it's an important thing. And there were 104 confirmed cases of rickets in kids between these 2 years. Now, my suspicion is that this is probably better these days, because I think there's a lot more awareness of vitamin D and we wouldn't see such levels. Nevertheless, it's not as if rickets is a thing of the past necessarily. And here, so where are Canadians in their vitamin D levels? In the this is a survey. Surveys are not terribly accurate, but we're getting some idea here. If we look in terms of the percentage of Canadians that were above or below that cutoff that I talked about, the 50, we can see, as an example here, between the ages of 20 to 39 at the time of this survey, 41% of that category of the population were below the vitamin D cutoff levels. So it's definitely possible. In my experience, I've seen many people, even those taking 1,000 IU of vitamin D, and I was one of them, who are still low. In fact, I was low at 1,000. I was still low at 4,000. And at one point, I got a prescription vitamin D for me to go up to 10,000. And I didn't stay at those levels indefinitely. I brought them down. That's just me. I'm not saying that's going to be you, but I based it on blood tests. Now, this is the Canadian Pediatric Society's position statement, last updated in 2021. I won't read this through because there's a lot of stuff on here, but you can come back to it in the recording. You can take a snapshot of it. But, I thought it was very interesting. Vitamin D deficiency is common among adults and children in Canada, is what they said in this particular statement. And, and then the rest is kind of the devil's in the details about that. So evidence is growing that vitamin D requirements vary with weight and BMI. So as I mentioned, with obesity, you probably require more. Okay, so what about the forms of vitamin D out there? Well, there's really 2 types that you can find if you're shopping in the store. There's your D3 and there's your D2. The source of D3, for the most part, comes from sheep's wool. That's lanolin. So that is not, I guess, technically vegan, depending on how you define it, because it's an animal product. There is a vegan form from lichen or lichen, I've never known how to pronounce that does actually offer some vitamin D3. What I find interesting, why I put this little star, is lichen is actually a natural source of both D2 and D3, And yet on the supplement labels, I only see D3 usually, or I've never seen D2 shown. So that is just a little bit interesting to me. I'm just going to put it that way. I have a question mark in my head. Why they're not showing the D2 in there? Vitamin D2, though, you can get as a form as well. It can be synthetic, or it can come from mushrooms typically. Now, vitamin D2 versus D3 is a difference. Are they equivalent? Does it matter which one you take? So there are 3 things here that I will tell you. You can kind of make up your own mind. Now, if you're vegan, don't worry about it, because regardless of what I have to say now, you can rely on a blood test to say whether or not you need more or less. But vitamin D2 is metabolized and cleared from the body, so removed from the body more rapidly than vitamin D, which suggests that, yeah, maybe it's not as good as D3. It's not hanging around as long. There's another issue is that the lab tests are really designed better to measure D3 levels, so they may underestimate your D2 levels. So if I knew that my vitamin, say I'm just taking vitamin D2, and I'm right at that 50 mark where I'm just at the cutoff, I might say, well, but this could be an underestimation. I may have more. So it's just something to know. Nothing to do that we can do about that at this point. And I've also learned that the difference in between taking D2 and D3 probably doesn't matter when it's low doses. Low doses, I mean, if you're taking like a 400 IU, maybe 1,000 IU, but for those taking what we call heroic doses, like 50,000 IU, and that's not something you should do on your own. Occasionally, a medical doctor or naturopath may prescribe, because this is a prescription, very high doses taken, could be once a month, once a week. They do it to their own discretion for a short period of time. In those kind of heroic doses, the difference may be much more dramatic between D2 and D3. So just to keep that in mind. All right. So then how much vitamin D2 do we need? Well, here is, just pay attention to the right side here. Here is some Health Canada's directives for us. And this is in the units that I'm going by, the IU, the RDA. You can see it does vary by age, but not much. So, it's around 600 on the average for adults, goes a little bit higher in our older age because we're not making it as well. So you can see like 800 here if you're over 70. And the upper limit, based on Health Canada guidelines, where they say you shouldn't go beyond this, is 4,000. Now, again, if it's doctor recommended, that's different, but that's their general advice. 4,000 for most people is going to be. And in my experience, the vast majority of people don't need to go beyond 4,000 to get their levels up, but there are going to be exceptions. I did want to put this, not at all to scare you, but there's some information out there on the internet where there's people saying vitamin D is very safe, you can take very high levels, it's never a problem, and that's definitely not the case. You can get vitamin D toxicity. It mostly has to do with the fact that you are going to absorb too much calcium, and the buildup of calcium can progress to, now this is not the first symptom, but it can progress to bone pain, kidney problems. So you get calcification, you get calcium depositing in areas of your body that are not your bones where you don't want it. You can get calcium stones and calcification of organs. So it can be very dangerous. It may occur, mostly what I see out there, blood levels of 375. So remember that cutoff is 50. This is way above that. It's above the upper limit of the lab that I go to in my area by quite a bit. So at least we have some idea, but it can vary from person to person. Some people may be more sensitive to that. And, the whole metabolism of vitamin D is complex. So it's just a general marker. And when we are taking high vitamin D levels, typically, hopefully, if your doctor, naturopath, whoever it is informed of the putting you on high levels, they're usually going to balance that with some other things like vitamin K2 is one key one. I take vitamin K2 along with my vitamin D always, because I do take I take 5,000 a day as recommended by my own naturopath that I see. So I take the vitamin K2 a couple times a day. Vitamin K2 helps to direct that vitamin D to your bones. And so should be, you know, it's one of the ways in reducing the incidence of it depositing where we don't want it. So our sources of vitamin D, just to take it back again and simplify it, we got foods, we have sunlight, and there are body stores as well. I suspect if somebody is losing weight rapidly, they might be releasing the vitamin D into their blood, and it may become a source. Now, this is a fascinating historical perspective of vitamin D put out by the Vitamin D Society. If you have the time to watch the video here on YouTube, I highly recommend it. It's very interesting. But what was asked by the Vitamin D Society, and the video is by Dr. Reinhold Vieth, one of the experts in vitamin D out there. He certainly has opinions that maybe not everybody agrees with, but he asks, what are the biological normal levels that we would have gotten, you know, that our ancestors would have got versus maybe what's normal for Canadians these days? And based on that, how much do we need to supplement to reach those norms? So his opinion, not Health Canada's, but if you look at our old world primates, what he says is that they would have had levels of over 100, at least half of the population. So in the red here means about 50% of the old world primates would have had levels above 100 just naturally, being out there in the, you know, in a lot of sun, and they would probably live near the equator. And even those who were outliers, who were higher and lower, all of those people were above, well above the cutoff of 50, which is here. Here's the cutoff. Then this experiment was done, kind of taking humans, exposing them the full skin surface, front and back. This is in, what do you call it? When you go into get the tanning, like a tanning salon, which I don't recommend, but that's how they did the study. I think they went in 3 times a week. And what they found was then people would produce over 80 on the average. So 50% of people would be over 80. And the outliers were all above the 50, so no issues. Then take people in the dead of the Canadian winter in Toronto. Now you have a very different story. 50% of people are below the cutoff at 39. This doesn't surprise me at all. Some are way below and some are above. So by this, it seems like, well, if we're just relying on the sun in Toronto in the winter, this is not looking good. But what if those people take 1,000 IU a day of supplements? Much better. Half of them were fine, above, and then you have the outliers above, and some of them, though, were below. Not a lot, but some people are still below. So 1,000 seems to be good to meet that cutoff for most people, but not all. When they tested instead 4,000 IU, everybody was in the norm. So that's why in the, you know, with the Vitamin D Society and based on this video, they would say, well, probably most people need more than 1,000. Again, what I'm saying is not prescriptive, it's descriptive, not prescribing, because vitamin D supplements in our stores, the highest dose that Health Canada allows for you as a consumer to take is 2,500. So this amount is above that, which means it is something that would be suggested from your doctor or whoever it is who's reviewing your blood tests. So vitamin D and common diseases. Again, this is coming from the same group of grassroots scientists who advocate for the prevention of not only rickets and osteoporosis, but other diseases. So what they show is the link here is what they're showing is the link between high blood levels of D 125, so well above that cutoff, and the reduced incidence of diseases. So if we're at those levels, 100% reduction, nobody's getting rickets. So that is that's a good thing. But there also seems to be an 80% association, 80% reduction in type 1 diabetes and 80% reduction in vascular disease, cardiovascular disease, reduction in C-sections, in falls, type 2 diabetes by 50%, fractures by 50%, MS by 50%, heart attacks by 50%, and preeclampsia, which is something you can get in pregnancy, by 50%. But these are associations. So hopefully you have learned that an association is not the same as a cause. And that's important to keep in mind, which is why I'm going to show you some studies rather than just associations, so you can make up your mind. But here is a way of looking at, well, the correlation versus causation. So what might it mean when someone has high vitamin D levels? Higher disease activity may simply, and when we're looking at those diseases like diabetes and all of those I just showed you, but those higher disease activity may simply be associated with less time spent outdoors. So it might not be low vitamin D that's causing those things, but less time spent outdoors. Time spent outdoors does, of course, impact our vitamin D levels, but it impacts other things. When we're not outdoors as much, we may not be getting rest and relaxation, which is important for us. We may not be as active. Here's somebody, out playing, I think that's cricket. We may not be socializing as much. And by the way, when we're out in the sun, we're not just getting vitamin D. There's evidence that being out in the sun can also increase levels of other hormones like serotonin. So we don't know for sure if it's just the vitamin D or if there's other things that are associated with the fact that we're outdoors. So let's look then at the evidence for using vitamin D. This one I think is so important because I've observed it in all too many of my, like on my own aging parents and all of my friends' aging parents, that falls are a huge risk factor for a dramatic change in the quality of your life. So over 60-year-olds here who consumed 80 IU of vitamin D2 or D3 daily have a significant reduction in the risk of falling. And this is from the European Food Safety Authority. And the panel agreed that vitamin D supplementation, when combined with calcium, could benefit body sway, muscle function, and strength, or both together, with a significant reduction in the risk of falling. So you remember I mentioned that vitamin D has many roles as a hormone. Not only does it strengthen our bones, it actually has a role in our muscle functioning and our nervous system functioning. And all of those could play a factor in whether or not somebody is stable or not. And also there is, of course, the fact that many elderly people have atrophy in their muscles, which is a whole other topic, which I hope to do for you guys next year. What about vitamin D and the flu, or risk of the flu? So here was a clinical trial, 1,200 IU of vitamin D given to children in one group versus none in the placebo group. This was done with Japanese school children from December to March in the wintertime when you expect they may be lower. And the study group was 58%, had a 58% relative risk reduction of the flu in comparison to placebo. And then there was a subgroup of kids who had a history of asthma, and they experienced a 17% relative risk reduction in influenza. So there's, and I think most children are not put on, these levels, although they don't seem very high to me, but that is higher than Health Canada recommended for children and for adults for that matter. What about vitamin D and immunity? Very important these days. We have sort of a rude awakening and people are more focused on their immune system. So I decided to focus on COVID-19. By the way, there are thousands of studies out there on vitamin D, so I certainly didn't review them all. But you can see here a different This is a meta-analysis, so they're pooling together all of these different trials, but you can see here different trials all over the world looking at COVID-19 infections with the intervention of taking vitamin D, sometimes just for very short periods of time. Most of these are very short studies. The doses they were given really varied from, 5,000. Here we got very high amounts, 10,000, 200,000. Of course, that's going to be, I'm sure, just taken very intermittently, so it varies. But the main finding here is that the results of this meta-analysis suggest a definitive association between the protective role of vitamin D and ICU hospitalization. So less ICU hospitalizations for those who were taking them. So these were people that were in hospital but didn't have to go into intensive care. Now, I really like this particular analysis or meta-analysis, which is data from 7 hospital studies. And you can look at the green line here is where all the data was pulled together. And what it showed here is, now this was done at a time, this was with COVID as well, when vaccination was not yet available. I'm not making any commentary here on vaccines whatsoever, but it was just the study happened to be done when vaccines, before they were available. And patients with sufficiently high vitamin D serum levels preceding, so before the infection, were highly unlikely to suffer a fatal outcome. The lower threshold for healthy vitamin D levels, they say, based on this particular 7 studies, should lie at approximately 125 nanomoles per liter. So that's kind of the lower threshold. Remember, 50 was that cutoff, but here they're suggesting that the benefits in the case of these studies for having the maximum benefits were at 125, so higher, which suggests to me again, and there are doctors out there and naturopaths who would prefer that their patients are not only at the cutoff, but at a more optimal level. Like in this case, 125 would seem like an optimal level. So they will test them, their blood tests, and see based on the dose they're taking if they're at those optimal levels. Excuse me again here. What about cardiovascular disease? Important because it's the #1 killer. Well, my little sad faces here is because in this updated review, and what was the date here? It was quite recent. I left the date out here, but a very updated review looking at studies, vitamin D and cardiovascular disease. They said there seems to be no strong evidence for beneficial vitamin D effects on cardiovascular disease risk, either in the general population or high-risk groups. Is that the end of the story? Let's see. Another review here said kind of similar, that looking at cardiovascular events in large vitamin D supplementation trials, they looked at 3 different randomized controlled trials here. None of them had very encouraging outcomes when it came to vitamin D. But they did point out, which is important, that in all 3 of these randomized controlled trials, the mean baseline of vitamin D were already above that cutoff. And so I guess the critique is that if you're studying a population that's already above that cutoff, you may not see benefits. What if all of these trials had only involved people whose levels are below the threshold? Maybe we would have seen a different outcome. So I'd say the problem is with the studies. It doesn't rule out that vitamin D is important for cardiovascular disease so much as it just says that if you have people who are already above the cutoff of 50, you may not see any difference. But here we had something more interesting. So this meta-analysis, the effects of a correction of a vitamin D deficiency. So now they're taking people who are deficient in vitamin D and shown that with vitamin D supplementation significantly improved their arterial stiffness. So your arteries, if they're stiff, They can't expand properly. They got to expand and contract as your blood goes through them. In several subgroups, when they corrected the vitamin D deficiency, and this was the duration of the studies were at least 4 months with a daily dose of at least 2000 IU. So the question is, well, if vitamin D seemed to correct or improve arterial stiffness, what does that mean? So if we look at another study here on arterial stiffness, does having stiff arteries put you at long-term risk for certain outcomes? This is a very famous study, the Framingham Heart Study. And yes, so this quote from this study, our prospective observations of a large community, so the sample was nice and large. I added this in here, it wasn't in the quote, 7,283 participants, average age was 50 and was about a split of male and female, established the long-term prognostic importance of arterial stiffness for multiple health outcomes. So having stiff arteries increase the risk of, in this population, stroke, death, diabetes, dementia, and chronic kidney disease. So that to me says something very important, which is that, for those who are deficient in vitamin D, there is a risk for cardiovascular disease and all related things to it. So definitely there is a role of vitamin D in cardiovascular disease. We must make sure that we're at least within that healthy norm. And here, vitamin D and heart attacks, the health professional follow-up study, a lot, 18,000 men. I'm not sure why they just included men here. Free of diagnosis of cardiovascular disease at the time of blood collection, showed that those who had a serum levels of, now this is below that 50, so men who had serum levels below 37, approximately nanomoles, had an increased risk of 2.42 of a heart attack compared to men with levels of at least 75. So again, this tells me you want to have those normal levels for sure. And what about diabetes? So in this case, actually, we're looking at a population in this particular study of people who were at risk for type 2 diabetes. So they have what's called pre-diabetes, a systemic review pulling together studies. What is the role of vitamin D in that population who has pre-diabetes? In adults with pre-diabetes, vitamin D was effective at decreasing the risk for diabetes. Really important, that's great. Specifically, vitamin D3 reduced diabetes risk by 76%. Guys, that's a big number. In participants who maintained a higher mean serum vitamin D level of at least 125 nanomoles per liter during the follow-up compared to those who maintained a level of 50 to 74. So again, here we have 50 is the cutoff, but this particular study showed that there was an additional advantage other than just being above the cutoff of having higher levels up to 125 for those who were pre-diabetic in terms of not developing diabetes. So this is more and more evidence I'm seeing mounting here saying that, yes, we definitely want to be at that 50 cutoff or a bit higher, but I think there are definitely additional advantages of higher levels. And how are you going to get there? Blood tests. The blood test can tell you what levels that you need to get. Vitamin D and mental health. So basically, vitamin D does, acting as a hormone, have effects on chemicals in our brain that can affect our mood. Don't worry about the details here, but vitamin D can have an effect if we don't have enough in our dopamine levels in our brain and serotonin levels in our brain. Dopamine is, I think I have done a whole talk here recently, sometimes I lose track, on focus, which is for Healthy Planet. So dopamine is important for focus and motivation. It does have a role in our mood. Some of the newer generation prescription drugs for depression target dopamine in addition to serotonin. Serotonin you may be more familiar with. Serotonin has been kind of a very long time traditional target of prescription drugs for depression. And then so we pulled together information about vitamin D and depression and see, well, what more specifically can we know about it? This 2022 meta-analysis looking at randomized controlled trials, so looked at a whole 29 studies, good amount of people, about 4,500. Here's the age range, which is very large, and the doses that they were using. And what they pulled out from all of these studies was a couple of things. One, 8 weeks seems to be the minimum duration of taking vitamin D supplements to have an impact on mood or depression. And it seemed from these 29 studies that there was this minimum amount of 2,800 IU daily, a minimum threshold dose that seemed to have an effect on mood, most likely to benefit females. So again, now the supplement maximum that you'll find in a health food store is 2,500 IU. So this is a little bit higher. Vitamin D and neurodegenerative diseases, I thought I'd throw in. That would be a huge topic, and I didn't have time to review, again, probably thousands of studies. So I looked at this big meta-analysis. Neurodegenerative diseases, too, are such a huge conglomerate of different types of diseases. You can see along here, we got Alzheimer's disease and MS that were looked at. So what I did is I put red when the outcomes were negative and green when it was positive. But the issue with this is the results were so mixed and the studies so heterogeneous, meaning they looked at different ages, different doses, different lengths of administration, different populations. So it's really hard to draw any conclusions. But I would still say for anybody, whether you have a neurodegenerative disease or not, we want to have normal levels of vitamin D and probably optimal levels of vitamin D. Vitamin D also has some role in pain. Deficiencies have been linked to various chronic pain conditions. It might influence our perception of pain in multiple ways. And this is just a description of the details of how it might, vitamin D influences our perception of pain. For example, dopamine and serotonin, modulating those, which I've already mentioned, those play a role in mood, but also then perception of pain. There are other ways as well. So here is one meta-analysis looking at 19 randomized controlled trials, 3,436 participants. Now, pain, unfortunately, is such a diverse, it means many things. It's many different things, and there's many different causes. So hard to do a meta-analysis on it. Nevertheless, they looked at adults with pain who had been suffering from pain of different kinds for more than 4 weeks, average age 55. Most of them were women, probably just because I think women are more likely to have autoimmune conditions like rheumatoid arthritis or fibromyalgia, which is still in that gray zone of we're not sure what causes it. They even looked at menstrual pain, so it was very wide. But they did find, in very general, pulling that together, there was reduced pain compared to placebo of an average of 5.7%. And the results were particularly more in hospitalized patients. Vitamin D and fibromyalgia, in terms of all of the different pain syndromes, has the strongest evidence that I could find in clinical trials. So if you have fibromyalgia, definitely pay attention to this. So in people who are vitamin D deficient, supplementation appears to alleviate symptoms of fibromyalgia. There are 3 clinical trials, good quality, that show consistent evidence of a moderate improvement in pain. The doses in this one study were, though, quite high, 50,000 IU weekly for 3 months. But there's others that use low doses daily. So again, do not be using these high amounts without guidance from a healthcare professional, but definitely take care of testing your vitamin D levels if you have fibromyalgia. And I think I just got 2 more slides here. So I just wanted to show you some of the variety out there of vitamin D that there is, in case you're trying to make some decisions and you're not taking it already. So even now we have such a huge variety. Now, some of them are very simple in terms of differentiating them. We got a vitamin D2 that's suitable for vegetarian or vegans. So that's sort of an easy one. You'll notice the doses are different, but by and large, 1000 IU is certainly the most popular or most common. I was probably the better word dose. You can get lower ones like 400 IU. They come in a different base. This one's a dry form. This one is in a virgin olive oil base, olive oil and safflower oil. And it's good that they're in oil because it's fat soluble, but you still need to take it with a meal because you don't have 2 teaspoons of oil in those soft gels. We got a chewable for people who are going to benefit from the chewable. This one is 1000 IU. Keep away from pets. Anything that has xylitol in it is toxic to dogs. We've got our really lovely now kids vitamin D3. This is a 100 IU per drop. Adults can use it too. They just have to count the dose and give a different dose. This is in a base of MCT oil, which is from coconut oil. It's no flavor, so easy to just put into drop into any food. Kid will never taste it. It's very neutral. And then it has the doses here. So this can be taken from age 0 to 13 and upwards, of course. So, and no risk information. So very, very safe to give vitamin D as one of the very few supplements you can give to somebody, right at the beginning of their life. And we've got a liquid vitamin D for adults, even though the kids one can be used, but this is 1000 IU per drop. So that's a little more economical for adults that may be taking higher amounts, but don't want to swallow pills or can't swallow pills. We have our higher dose 2500 IU. This is the only one that has a claim on the bottle that will say, for those at risk of osteoporosis. And then we have a vitamin D and K2 combination. We also have K2 separately. So I take mine. I don't know if you guys can probably not see very well with my background here, but anyway, I take the D3 2500 and then a MK7 or vitamin K with it. As a little note, a little aside, because you can't see it on these bottles, but on some of our vitamin D bottles, has a Vitamin Angels little logo on it. And that is because of Vitamin Angels, which is an amazing charity that helps mothers and children in Canada and the developing world. So part of your purchase of the vitamin D goes to that charity, and now is a very, very long time and one of the first supporters of this charity at its founding. And lastly, before I take questions, I just wanted to summarize this all for you. This is where if you want to take out your phone and just take a snapshot just to remember the main details. So vitamin D benefits may include bone and teeth matrix support, 100% the evidence there, I'd say. But as you can see what I went through, it may also reduce risk of cardiovascular disease, provide metabolic support, so helpful for those who are at risk of diabetes, immune support. With those, remember the studies I showed that it seems sometimes having higher levels than that 50 cutoff may be beneficial. Vitamin D supplementation doses are best based on blood testing, don't guess. Vitamin D2 and D3 are likely equivalent in their benefits at lower doses, but that may not be the case if we're taking like higher doses or heroic amounts. But again, all you need to do is do a blood test and adjust whether you're taking D2 or D3, so don't worry about it too much. Target blood results should be a minimum of 50 by global standards, by most standards, but there may be as high as 100 to 150 for reduced risk of some diseases. Certainly more studies are needed to confirm the exact best range. That will always be the case. We'll never have enough studies for most things to be definitive. Any dose above 2500 IU vitamin D in Canada is considered a prescription and should be done under advisement. And the upper safe limit for D, according to Health Canada, is 4000 IU. And that is the end of my vitamin D journey with you. Thank you so much, everybody, for attending and listening. And I'm now happy to take questions.